Today we will be discussing genetic testing in periodontal disease. Is genetic testing? It is a prognostic type of test that can identify changes in chromosomes, genes, and proteins. These tests can confirm or rule out suspected diseases and determine if it is hereditary. Formerly the PST test, now known as the Periodic Genetic Risk Test, is not a diagnostic test, it is a prognostic test. Diagnostic tests can be positive or negative, whereas a prognostic test predicts the likelihood of disease development. The genetic test, if positive, means there is a high chance of chronic periodontal disease. If this is a result for a patient, it allows dental hygienists to formulate a care plan specific to their needs. It is reported that 1/3 of those with periodontitis is due to a genetic deposition. According to the Canadian Dental Association, 7 in 10 Canadians will be affected by gum disease, making the advancement of genetic testing in periodontal disease a very important factor in promoting better oral health and disease prevention. A patient's genetic makeup affects the susceptibility to many diseases, including periodontal disease. With the advances of genetic testing in periodontology, we can determine if a patient is at a higher risk for severe and progressive periodontitis. The first version of the test was the PST genetic susceptibility test, with a new version named Interleukin's Periodic Genetic Risk Test. If the test results exhibit higher levels of interleukin-1, this predisposes the patients to inflammation in the periodontium, which is linked to an increased risk for periodontitis. There are many advantages and disadvantages regarding genetic testing. Genetic testing can help advance the early warning signs of periodontal disease, as there are certain types of bacteria specifically associated with periodontal disease. Finding the bacteria will also allow for a precise diagnosis of periodontal disease. This leads to having an adequately tailored treatment plan, knowing that information early on. When assessing for periodontal disease, clinical assessment and environmental factors should not be overlooked. Alongside the advantages, some disadvantages arise. There is no specific gene, but at least 11 types of bacteria are related to the disease. This means genetic testing cannot be solely responsible for diagnosing periodontal disease. The other factors should not be overlooked. For example, environmental factors such as smoking can significantly impact the susceptibility, rate, and progression of this disease.
The uses of genetic testing and biomarkers are one step closer to providing care by precision treatment as opposed to treating the average patient with periodontitis. Sometimes, when a patient is assessed, periodontitis is already present, so past tissue damage is being assessed as opposed to preventing the damage. While radiographs and periodontal probing is essential for detecting and preventing the progression of periodontitis, biomarker information can fill the gap among detecting and treating periodontitis. With biomarker information, testing the patient's likelihood and susceptibility to periodontitis can prevent the patient from receiving a late diagnosis and treat the disease, or completely prevent it before it is capable of progressing. More importantly, genetic/biomarker testing is capable of detecting when a patient may be highly susceptible to periodontitis without the need for radiographs to detect bone loss or clinical examinations to determine if a patient has periodontitis or if they're likely to have it later down the road. With biomarker testing, it allows the individual to be aware of their risk of periodontitis, but also allows the clinician to provide a precise patient-focused approach in preventive care.
Future directions for genetic testing, supplemental diagnostic testing. Some salivary-based diagnostics for periodontal disease are available commercially and can help to identify bacteria strands associated with the disease. GCF, Gingival crevicular fluid that is present in a pocket contains GCF markers. These markers help mark disease such as inflammatory cytokines, enzymes, and tissue breakdown products that are associated with periodontal disease. Pieces of bacterial DNA are used in hybridization for the identification of bacteria. Hybridization is the process of two single-stranded DNA molecules being bonded together. The use of hybridization reactions is to probe for complementary DNA in subgingival biofilm samples.
20% of the Canadian population and 11% of the worldwide population have periodontal disease. Thank you.